I'm Bailey, and my group mates are Erica and Mitchell. Today we'll be talking to you about the lymphatic system and types of lymphoma, including non-Hodgkin's lymphoma and Hodgkin's lymphoma.
The lymphatic system is a system of thin tubes and lymph nodes that run throughout the body. These tubes are called lymphatic vessels. The lymph system is an important part of our immune system. It plays a role in fighting bacteria and other infections and destroying old or abnormal cells such as cancer cells. Lymphatic system organs include lymph nodes, tonsils, the spleen, and the thymus. The lymph vessels branch through all parts of the body, like the arteries and veins that carry blood. But the lymphatic system tubes are much finer and carry a colorless liquid called lymph. Lymph contains a high number of a type of white blood cells called lymphocytes. These cells fight infection and destroy damaged or abnormal cells. As the blood circulates around the body, fluid leaks out of the blood vessels into the body tissues. This fluid carries food to the cells and bathes the body tissues to form tissue fluid. The fluid then collects waste products, bacteria, and damaged cells. It also collects any cancer cells if present. This fluid then drains into the lymph vessels. The lymph then flows through the lymph vessels into the lymph glands, which filter out any bacteria and damaged cells. From the lymph glands, the lymph moves into larger lymphatic vessels that join up. These eventually reach a large lymph vessel at the base of the neck called the thoracic duct. The thoracic duct then empties the lymph back into the blood circulation.
Lymphoma is a type of cancer of the lymph nodes. It occurs when lymphocytes grow and multiply uncontrollably. There are two types of lymphoma. There is non-Hodgkin's lymphoma, which is NHL, and Hodgkin's lymphoma, which is called HL. Non-Hodgkin's lymphoma is more common of the two, but it's less serious than Hodgkin's lymphoma. Symptoms include swollen lymph nodes in your neck, armpits or groin, abdominal pain or swelling, chest pain, coughing or trouble breathing, persistent fatigue, fever, night sweats, and unexplained weight loss. The different types of non-Hodgkin's lymphoma include chronic lymphocytic leukemia, cutaneous B-cell leukemia, cutaneous T-cell leukemia, follicular lymphoma, and Waldenstrom macroglobulinemia. Non-Hodgkin's lymphoma is often caused by a weakened immune system. Non-Hodgkin's lymphoma is most usually not fatal. Serious risks don't usually develop completely, and patients tend to make a full recovery. Treatment includes 3 main standard types of treatment for people that have been diagnosed with non-Hodgkin's lymphoma. They are chemotherapy, radiation therapy, and targeted therapy.
There are different types of HL, but 95% of HL cases are classic HL cases, mostly affects people ages 20 through 40 and those over 55. In Hodgkin's lymphoma, cells in the lymphatic system grow abnormally and may spread beyond it. Doctors aren't sure what causes Hodgkin's lymphoma, but it begins with an infection-fighting cell called a lymphocyte, develops a genetic mutation. The mutation tells the cell to multiply rapidly, causing many disease cells that continue multiplying. All right, can you pause? The mutation causes a large number of oversized abnormal lymphocytes to accumulate in the lymphatic system, where they crowd out healthy cells and cause the signs and symptoms of Hodgkin's lymphoma. Symptoms include painless swelling of lymph nodes in your neck, armpits or groin, persistent fatigue, fever, drenching night sweats, unexplained weight loss, severe itching, increased sensitivity to the effects of alcohol, or pain in your lymph nodes after drinking alcohol. Different types of Hodgkin's lymphoma include nodular sclerosis, HL, mixed cellularity HL, lymphocyte-rich classic HL, lymphocyte-depleted HL, nodular lymphocyte predominant Hodgkin's lymphoma. HL tends to include more serious risk factors than non-Hodgkin's lymphoma. Advances in the diagnosis and treatment of Hodgkin's lymphoma have helped give people with this disease the chance for a full recovery. The prognosis continues to improve for people with Hodgkin's lymphoma. Risk factors. Hodgkin's lymphoma is most often diagnosed in people between 15 and 30 years of age, and those over 55. Having a blood relative with Hodgkin's lymphoma or non-Hodgkin's lymphoma increase your risk of developing Hodgkin's lymphoma. Males are slightly more likely to develop Hodgkin's lymphoma than are females. People who have had illnesses caused by Epstein-Barr virus, such as infectious monosclerosis, are more likely to develop Hodgkin's lymphoma than are people who haven't had the Epstein-Barr infections. There are 3 standard methods used to treat Hodgkin's lymphoma: chemotherapy, radiation therapy, and surgery.